Hello, hello. It says my live is starting. There it is. All right. Hello. Happy Tuesday, everyone. Excited to be here this Tuesday. April 22nd. Happy Easter to all of you from last Sunday. Hope you all had a great time celebrating time with family. And this is Dr. Miriam, Family Nurse Practitioner here at Innate Healthcare Institute. And we are doing these lives, Tuesday lives. They have been become super fun, a great way for us to answer anyone's questions. And so I don't have any staff with me today. So I'll just kind of go off the cuff and see what happens. So as you join, I'd love to know where you're joining from. And please let me know if you have any questions. So I'm going to go over some ways in which you can get a hold of us for questions. So here you can repost on under this video and ask any questions. You can message us at info@innatehealthcare.org. info@innatehealthcare.org. And also, you can post on our Facebook page. You can post for many of you out there who are prospective parents or current parents of ours. We do have a Facebook group that you do have to answer some questions to get into, but the group is a space where you can connect with other parents. You can get their insights. I know that is a helpful thing when you have a kiddo that's going to undergo a procedure, to get other parents' insights on what their experience was, what the outcomes looked like. And so we do have that available. And that, I'm going to look because I don't remember off the top of my head, is Innate Autism Stem Cell Families. So Innate, INNATE, Autism Stem Cell Families. That is our website. And so feel free to ask questions there too if during the live you missed it or were unable to attend and you had some questions or something came up afterwards. This is a great resource, especially connecting to other parents. I have that question asked of me often in our on the consultations that I do, and Dr. Ashley does. And we get that question often. Hey, do you have somebody that we can talk to who is a current family that is open to talk to a prospective family? So know that you also have this resource available. And so for all of you, hello, all of you who are tuning in. So some things to keep in mind, that I've seen some questions kind of through the thread is, there's kind of a question around how do parents pay for or afford the treatment. And do know that we have, of course, first steps are to do a consultation with us so that we can answer your questions. But our front office is fantastic at explaining. We do have financing options, not directly through us, but a third-party company. And so for some, that is very helpful. The company, you would decide on what package you wanted. The company is going to pay us in full, and then you pay them monthly. So sometimes, obviously, finances are always something that you have to be mindful of. And the recommended number of visits for us is 1.2. Recommended number of cells is 1.2 billion. The plan. So each visit is 300 million stem cells. The total for that is 33,000. And so just know that we do have some financing options, and maybe that's something that'll make it a little bit more affordable for you and for your family to be able to come and do the visit with us. Any of the pricing that we have does not include lodging, but we do provide information for lodging. And we're happy to give referrals. We have like Airbnb people have stayed at. We do have a Great Wolf Lodge here. I know for different cities have the Great Wolf Lodge, and the kids just love it. There's like indoor water parks and I think like rock climbing and all sorts of things. And I just hear great things about it. So know that that is here as an option. But all that is, there are separate costs. So we keep that in mind. And so another thing I want to speak to on that is around the timing of the visits. And so just to clarify on a previous video, that when, the more and more people we've been seeing for, for autism, for the kiddos that we've been seeing, um, when we look at outcomes, I think it's important because, as if anybody's tuned in before, I'll touch on it quickly, but the way that we see the greatest outcomes for kiddos is like a three-part approach. So it's the stem cells, which are doing, improving the foundation, improving the neural connections, decreasing inflammation so that the cells can communicate the way that they're supposed to. So there's a lot that is just done via the stem cells. But changing behavior is not. Changing behavior is up to you, to your family, to the therapist, to the people that you're working with. And that consistency factor between the therapist and the family is super important. But that's a big part of getting outcomes. And speech is an outcome. Changing behavior, that's an outcome. And so the behavior aspect is huge. The cells are going to give your kiddo the ability to understand what it is you're trying to teach them. And then it is up to you guys, your family, to really work on those behaviors. And lastly, then it's the testing. So cells, behaviors, testing. Testing is just, how do we optimize your kiddos' bodies so that optimizing alone can lead to improvements in cognition, improvements in behaviors, improvements in sleep and gut health. Yes, all those things alone. That then even the stem cells don't have to go after. Like, the stem cells won't necessarily remove a toxin. They might help the liver function a little better, like decreasing inflammation. But if we optimize the body, now the cells don't have to go after the inflammation being caused by the thing, the pathogen that's present, the toxins that are present, whatever is happening within their body. So how can we optimize the body? Through supplements. And so it's all three of those that make a difference. And so that's where, when we talk about, and that's something that is, within the last 2 years, we've been doing more consistently and having that awareness about how much that makes a difference. And so when we talk about how often do you need to come, our hard stop is nothing sooner than 3 months. We want to allow the cells enough time to work, to allow them to really start healing the body. And anything after that then is kind of fair game. So for a long time it was, 3 to 4 months. But the reality is, I usually tell parents it's around 6 months, because maybe it's a little bit before, maybe it's a little after. But the reality is, when you're looking at the fact that the stem cells are still alive and working in your body for months, and the fact that we're also, for the vast majority of families, not that it's required, but it's highly recommended. We're also working on the protocol for the gut and the toxins. And then you're working on the behaviors with your kiddos. Those things, that just takes time. The behavior modification, those changes. So you can continue to still work on those while obviously you're not here. And so then, even to say, like, at 6 months or 8 months, that's still an okay time. And so I would say, ideally, if you can get in with around 6 months, keep in mind also what's available for our office, because with the 2 doctors, we are booked out a couple months already. And so keeping in mind our availability, your availability, a lot of people want to try and get in when their kids are on vacations, and those spots fill up fast. So keeping in mind that factor, but also understand that if it goes over 6 months, if it goes 8 months, we have some families that can only come once a year. We still get outcomes, because, again, so much of it is not just the cells. The cells are amazing and so helpful. but a lot of it also is the behaviors. And so I would say for some new parents, new to our clinic, if you have, I spoke to some parents recently who have a kiddo that can be quite aggressive. Aggression is a means of communication. Aggression is a learned behavior that, um, when experiencing, when a kiddo is aggressive, they've learned that, hey, I get a lot of attention when I'm aggressive, or I get a lot of attention when I do XYZ that is aggressive or self-harming. And that's a behavior they learn how to get attention. So then that becomes a mode of communication for them. If you're experiencing that, um, and you are scheduled to come visit us and you haven't quite met with Cece yet because you haven't had your first visit, know that she does allow sometimes for appointments. She does 30-minute consultations. They're $150, and she does them over Zoom. And she can start working with you to start addressing those behaviors, especially if you have aggression or self-harm. I do think it can be helpful to make an appointment to discuss with her some of the potential options before you even do stem cells. Because as I was communicating with a family recently, they asked, can the aggression get worse? And the answer is yes. The reason is not just the cells made the kiddo more aggressive. They already use aggression as a means of communication. And so when we do the cells, they will have greater awareness. Therefore, they can have greater frustration. And if their method of communication is aggression, you're going to see an uptick in that behavior. Not because the cells are causing the aggression, because the cells are making them more aware, and they either get frustrated or they're trying to communicate. And what they know is their way of communication that is effective is aggression. And so if you're in that boat, which we have lots of families that are, know that that's an available option, that you're going to talk to her when you come. But if it's a concern, so much of a concern that you might or might not do the cells, then consider that that option exists, that you can talk to her separately and have a consultation before you come see us. That maybe you can start working as a family on the behaviors, because it's not just the kiddo. It's, as a family member, changing our behavior toward our kids, and understanding what it means when they're trying to communicate through something like self-harm or aggression, and how to work with that so that they start to understand a different way of communicating. So it can be very helpful to try and look into that beforehand, and to understand that that is possible, both that you can mitigate it and also that it can make things a little worse. Again, not because of the cells, because but because of that is how they've learned to communicate at some point. So I hope that's helpful, because I get that often. Can they make things worse? So the answer is like no and yes. No, the cells don't make things worse, but their behavior can become worse if they don't already have the boundaries and understandings and ways of communicating that aren't through more aggressive behavior or self-harm or things of that nature. But we have you covered. We have Cece here. She's fantastic. And so it's really helpful. And so all that to say, let's go back to the original point, that you can still keep working on those things. If you can't make it in that window of 6 months, and you have to be 8 months, it's okay. If you can only make it in once a year, I mean, as much as we'd like to see you sooner and like to get the cells in sooner, it also still works. There is no hard, fast rule. This is just kind of what we've seen. This is what we experienced. But as we experience more and more kids, more and more families, we have seen that it can go beyond 6 months. It can be 8 months. It can be 1 year. And you're still getting good outcomes. And so the cells are never going to be less effective. If you come at come once and then come 8 months later, they're not less effective. They still work just as well. So I hope that is helpful for some of you to understand. Anybody showing up in our live, if you have a question, please post your comment in the live chat. And there was something else that came up that I wanted to address, but it is escaping me right now. What it was. Thank you. Hi, Kabim. Hopefully I Kabim. Hopefully I said your name right. So while I see your institute specializes in neurodevelopmental conditions, autism precisely, I wanted to confirm if it also works with cerebral palsy. Yes, patients. If yes, could you please share some info? Well, I mean, the best way is just to do a consultation, um, to get the info doesn't change, right? So whether we work with cerebral palsy or whether we work with kiddos with autism, we still do the same dosing. So 300 million stem cells is considered a visit. In that visit, it'll be spread out over 2 or 3 days, just depending on their weight. Over 60 pounds is 2 days, under 60 pounds is 3 days. So that's 100 million stem cells each day. There is also a dose of exosomes that are included in there. Exosomes are the actual medicine of the stem cell. And when it's in our body, that's what the stem cell is releasing to communicate with the neighboring tissue, to heal and modify the tissue. It's the same thing in our lab. And so we take a dose and we mix the two together, and that just augments the healing. It gives us slightly better outcomes, which is why we started mixing the two together. So there will be a dose of that as well. So stem cells and exosomes mixed together in this exact same ways that we deliver stem cells right now. So for cerebral palsy, it's the same thing. And as with anything, the cells are going to go. We don't dictate where the cells go. We have the method of infusion. So we do intranasal every day. 50% of the cells are going to go intranasal through a syringe and a device called an atomizer, which is something that sits at the end of the syringe. And when I spray, I'll have to bring that next time. When I push on the syringe, the atomizer makes it so that the stream goes really far back. And so it goes really far back in the nasal passage, attaching to the nerve bundle that we're trying to get to. So nothing goes in the nose except for the spray. The atomizer just sits at the front. And so half of the cells are always done intranasal. The other half are going to be done if your child's younger, let's just assume. If we're doing a 3-day visit, then 2 of the days are going to be shots in the arm. 1 of the days is going to be IV push, meaning there's not a bag hanging and dripping. It's we access the vein, we push the cells, everything gets pulled out. So any of the days that we're doing this, we are done in under 3 to 5 minutes. And so patients with cerebral palsy, it's the same thing. They follow the same guidelines as to how we work with our other kiddos, and the dosing and the guidelines and the time in between. All that is exactly the same. Outcomes tend to be similar. We have a patient recently we were working with, very young, I think less than 2 years old, but parents are reporting pretty soon after their visit, within the first couple weeks, that they started noticing changes in just the awareness and looking around and kind of interacting with the environment, which is what we see in our autism patients. So we see increasing attention, focus, eye contact, socialization, affection, sleep, gut health. So I would say that I would expect to see some of those similar improvements. I can't speak specifically to some of the lung challenges, but we know from our chronic disease patients that we get improvements in a lot of the areas that are just functioning or have a lot of inflammation. Even just the decrease in inflammation can be helpful. So although we can never guarantee an outcome, as with any area, we never guarantee an outcome is going to happen. But we can say that 80 to 90% of our families, this is specific to autism, do get improvements. And so cerebral palsy, we have a section of our proposal, which once you do a phone call, it will describe very similarly the dosing guidelines that I just talked about. And so we're a little less clear as to all the expected outcomes, because we just don't see it as frequently. But I can say that a lot of them do kind of similarly follow what happens with our kiddos with autism, and just slightly different. So I hope that helps. I appreciate your question. If there's a follow-up question and something that you want a little more clarity on, feel free to ask it. The best way is, though, to just do our consultation, which is a 30-minute consultation. We did recently change from doing like 15-minute free consultations to it is now a paid 30-minute consultation. It is 150, but that gives us um, the ability to have more time with you to go over questions, and then that amount is put toward your final bill. So nothing is lost in the end. Um, and um, and that's your best opportunity. So you call and you just make your appointment, but that's the best opportunity to ask questions and you have plenty of time to go through. So I highly recommend we do send out a very detailed FAQ ahead of time that goes over, specifics about stem cells, how they work, how our process is, all those things. Go through it, look through it, read through it, familiarize yourself with stem cells so that when we're in the appointment, you don't have to ask those questions. Like they've already been answered and now you can ask the questions that are kind of more on your heart, like the questions about your kiddos and whatever concerns you have with doing what we're doing and your kiddos and outcomes and those kinds of things, and give us that time to really walk through those questions with you when more of the background stuff is understood. So please look out for that, and please know that that does come with any consultation that is scheduled. Um, so I hope that answers your question. And um, and I think for now, I'm gonna get going. And I don't have any more questions at the moment. And again, if anything came up for any of you and you want to ask, feel free to post down below. If you want to connect with our other families on the website or on our Facebook page, so our Facebook page for families is going to be that Innate Autism Stem Cell Families. You can connect there, and or info@innatehealthcare.org. Appreciate all you guys being here, and I hope that was informative. Let us know if you have any questions. Have a great rest of your week. Bye, guys.